brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good afternoon, New Jersey. Welcome to another Ask the Expert show where we bring you the top experts in the field of legal, health, financial, and home improvement. I got to tell you, about 3 months ago, I was so happy that we got the top agent, not only in New Jersey, but he's also our expert for Florida when it comes to Medicare and Medicare enrollment and the Medicare agent. And I'm so glad that we've got Stephen from. Hey, good afternoon, Stephen.
Good afternoon, Steve. How are you doing today?
Hey, what's the weather like in New Jersey?
The weather like in New Jersey. It's, as my Uncle Frank used to say, it's brown skies. Brown sticks and gray skies, and less than 30 degrees.
Ooh.
Mm-hmm.
So we won't tell him the temperature.
That's why he moved to California.
Got you. So first of all, I know you've got a letter you want to read, and also I want you to tell people about your company, first of all.
Sure. That'd be great. Well, I am the founder and owner of From Insurance Services. We started a few years ago. I'm a licensed independent agent now in 39 states. I have a great team of people that help me grow the business. And our job is to educate seniors and help them and make a positive difference in their life. And that's what we're doing on a daily basis. So it's a great thing. It really is a great thing.
I got to tell you, people love your personality. We got 4 letters from people saying, I know that Stephen is good, but he's fun to listen to. I can understand what he's saying. And that's one of the reasons why we do a show like this, because Stephen, there's so many people out there who don't understand about Medicare.
Yep. Well, as you and I talk about all the time, pick an adjective at this point to describe how confusing and overwhelming it is. And, that's tough for a lot of seniors to understand. So someone like myself is available to them and talk them through and educate them. We just finished the annual election period from October 15th through December 7th. And a lot of folks don't understand. They think, oh, wow, that's the end of Medicare. I can't do anything. But we're just starting again. We're preparing all the way for next year.
Exactly.
It never stops. There's always something to help somebody with. And like I said, one of the things I just mentioned to you briefly is come January 1st. It's the Medicare open enrollment period. And that runs from January 1st through March 31st. And that is an enrollment period for anyone enrolled in a Medicare Advantage plan. And that gives them an opportunity to either change their Medicare Advantage plan, or if they want to, they can go back to original Medicare and choose a prescription drug plan. And they can also look at Medicare supplemental plans. However, during that period of time, it's typically not guaranteed issue unless there's a specific circumstances, which we can always discuss. So if they're going back to Medicare supplemental, they have to realize they go through underwriting. There'll be some health questions, and the underwriter would determine whether or not they would be eligible for a new Medicare supplemental plan. So that's something we're always educating everybody on, explaining the difference. As well as with this open enrollment of Medicare Advantage, sometimes the plan that a senior enrolled in during the annual election period, maybe is not working for them. Maybe their doctors are no longer in that network all of a sudden, or certain prescription drugs are not covered, or they didn't realize the co-payments for certain other, procedures or coverage options. So now is a perfect time to review everything and for us to help them and find the right plan that's going to meet all of their healthcare needs. That's the bottom line we're looking to do.
Do you see companies pulling out of certain counties?
We saw that during the election period. Yes, there was certain companies that they discontinued their Medicare Advantage plans, as well as they terminated service areas. So that made a big difference for a lot of seniors. And, for someone that's in a Medicare Advantage plan, it's still an opportunity for them to, look at different plans. And that did cause a disruption for many seniors. I had situations, unfortunately, where in certain areas and certain states, there was no longer any Medicare Advantage plans. There was just none.
Wow.
And they had to go back to original Medicare And we're talking about someone that is possibly late, maybe late 70s or 80s, whatever, but they had health conditions. And even though they had health conditions, though, with losing their plan does allow them to get a Medicare supplemental plan without having to go through underwriting because there was a plan disruption. However, a lot of times someone's in a Medicare Advantage plan because of the cost associated with me. There's a zero copayment, a zero premium, or a lower premium. And now they go back to original Medicare, and there's a cost for Medicare supplemental plans. There's a cost for prescription drug plans, and they may not be able to afford that cost. So it's been very difficult, helping a lot of people, but we do our best to educate them.
Being an agent, I got to tell you, I have so much respect for what you do, because you have to do so much legwork. It's like putting a puzzle together with each one of your clients.
It's a constant puzzle. And I tell people all the time when we're speaking, I go, look, I know a lot of things, but I don't know everything. So a lot of times people will ask me questions, and I'll say to them, listen, I always reserve the right to do research for you. And I'd rather do the research and try to answer your question, and let's get it right the first time. And everybody respects that. I had a couple calls today. I'll be calling them back tomorrow. They have some issues that we're going to take some research to understand, and then I'll give them a call back and make sure that we help them properly.
We just got our first text in. This is from Marvin. I'm so glad you found an expert in this field. This is such an important show for us people who are on Medicare. I was just listening to your expert. I'm curious, if I'm on Advantage plan, can the company close up in the county that I'm in and pull out? That's a good question.
And the answer to that question is yes. It happens.
Wow, they can do that?
It happened in many service areas. And like I said, there were certain remote states that I work in that there was unfortunately no longer Medicare Advantage plans. There was just none.
Wow.
And they had to go back to original Medicare. And I can think of one particular woman that was on a very fixed income. And even though she can get a new supplemental plan without underwriting, it just became cost prohibitive for her. She just couldn't afford the cost. So a big gap going forward. She just has A and B, which is 80%. She doesn't have that supplemental plan for the additional 20%. And I feel bad for her. That's definitely going to be an issue for her. It's definitely going to be an issue. So
Greg in Cherry Hills wants to know, what is the difference between a regular Medicare and the Advantage plan?
Well, as we mentioned previous in some of our shows, original Medicare, you have your Part A and your Part B for your hospital and your doctors, which cover 80% of the cost. And then you have your Medicare supplemental plan, which is a separate policy. Each carrier has to offer certain plans, and there's a cost to that. And that covers the additional 20%, giving you the 100% coverage. And then someone has to enroll in a Part D prescription drug plan, which of course there is also a premium for that and the cost of the drugs that they have to pay. And there's been a big shift on how drugs are covered right now compared to your Medicare Advantage plan, where it's kind of all inclusive. You have your A and B and your supplemental, a part of that. So you have your hospital, your doctor coverage. There's also a lot of additional benefits for someone: vision care, dental, hearing, some over-the-counter benefits. But again, just because it's a zero premium plan doesn't mean that you won't have costs. And that is what we do. We educate the senior on the cost, as well as we need to make sure that their doctors are in network and their drugs are going to be covered properly. So there's always the education, as you said. We're always learning. I'm always learning, and my clients are always learning.
Stephen, what's been your biggest surprise this year with Medicare?
There's a lot of surprises this year.
I know. Listen, I went to go get eyeglasses, and they said it'll be 140. I said, but 2 years ago I didn't pay anything. They said it was 2 years ago. That's a
perfect example. A lot of the Medicare Advantage plans are still zero premium, but the cost has changed. Maybe last year you were paying $5 to see your primary care physician, and now you're paying $15. and maybe the cost of going in the hospital has increased. So that is where a lot of the education constantly comes in place with as advising on Medicare Advantage plans. Just because it's zero premium doesn't mean you're not going to have a cost, as well as maybe you're in the right plan, but you didn't realize that your costs are going to go up to see the doctor or see the specialist. And that $10 or $15, that's a big difference for some seniors. That is a big difference. And it adds up, especially if you're going to see a lot of doctors. So
yes, especially if you're on a fixed income, I mean, it makes a difference. A lot of people, Stephen, are upset about these national commercials and the things that they promise, and then they call up to find out it's not in their area. I mean, I know I had, I guess, a small grocery allowance. I think it's like $35, and they don't even offer that anymore. But people are really upset about the national commercials.
Yeah, well, the national commercials can be misleading. I'll be very vague on that one. Can be misleading. And so that's why someone like myself as an independent agent comes in, a lot of those commercials are, call XYZ company, call me, and let's review all the plans. I just had a gentleman before I hung up with, his over-the-counter card was $275 a month last year. Now it's $125.
Wow.
So exactly. And he's on fixed income. So this is really going to affect his monthly budget. Same plan, just the benefit change.
You're an independent, right, agent, right?
Correct. Yes, sir.
So you represent a lot of companies.
Correct. I'm licensed with quite a few companies, which allows us to evaluate.
What's been the biggest question that everybody has this year?
Cost.
Yeah.
Cost. Prescription drugs has been a real focus this year. A lot of the plans increased their premiums, from $20, $30, $40, $50, $60 a month. And that's a big impact for someone, as well as their drugs. Maybe their prescriptions were being covered on, depending on the tiers 1, 2, 3, or 4. And maybe that particular drug that was a tier 3 or tier 4 drug is no longer in the formulary. So there's an additional cost for them. And that's where someone like myself comes into play and educates them. And maybe that low premium plan that they had, the drug is the prescription is no longer being covered the way it was. But maybe a plan with maybe a slightly higher premium is going to cover that drug on a different tier. So those are all the cost analysis we have to break down for somebody.
And I don't want to get political, but I want you to check something for me for our next show, because we're starting to get people with this question. We saw the president go on live TV with some of the biggest major drug companies, and that we were going to start getting 75 to 80% off. How come that's not showing up yet?
That is a great question. I literally just had this conversation with someone this morning that has been paying $1,000 a month for her prescription, and it's going to $375. And her question was to me, I thought they were going down even more. And that's the question. And I will be more than happy to do that research for you for our next call, because that is an important question to ask. And like you said, you're not the only person that saw that. And that's
they were talking 80%, Stephen, 90%. And I haven't heard, and it was a lot of drugs, because 3 or 4 of the biggest manufacturers, I mean, that's a lot of different drugs. And I bet you insulin's a very important one. So that's probably one that everybody wants to know about.
There's a various drugs, and I can for our next show, I will definitely do my research for you and come back and give you some examples of the cost of some of those prescriptions. I'll use my favorite word. There's a plethora of medications out there that can.
I love it when you use big words around me.
It's one of my favorite words.
I want to find out. your show goes by so fast. I want to find out. So, if a person is going to become 65, what do they need to do?
They need to call us. They need to call us and understand what is called their IEP, their initial election period. It's very, very important. As you know, we have spoken about that in the past. Turning 65, there's an election period, which is 3 months before your 65th birthday, the month of, and 3 months after. And it's very important to make sure that you enroll properly in Medicare during that time, because if not, you could incur lifelong penalties. So one of the things I especially, right? Yeah. So one of the things I'm very proactive, is speaking with someone those 3 months in advance, getting them enrolled in Medicare properly. We help with that. We go on the Social Security website. We help them get enrolled with Part A and B, but it's going to take a while for them to get their card. This way they can get their card the next month, and they'll have their Medicare number and their eligibility dates. And this way we can properly enroll them. And when their birthday comes around, it's effective. So it's really important to start the conversation 3 months in advance.
I got to tell you, I love Medicare. I mean, we've been paying for it all of our life. But I want to tell people again that it is so important that you find a good agent like Stephen, that it's amazing what having a good agent. I know what it's like having a lazy agent when I first started. Stephen is not that. There's so much legwork to do, and we're going to give Stephen a chance. Even though it's on YouTube, we've got radio and we got Spotify, iHeart. People who can't see that we've been running your phone number. Tell people how they can reach you and your website.
Great. And Steve, I mentioned everyone's situation is different. So that's why we take the time to go through everyone's situation. They can reach us. They can give me a call at area code 908-510-3418, or they can go to our website, which is www.fromme.com. And on our website is a contact form. So they can fill out that form and it will automatically come to me, and we will give them a call immediately.
And if you've got like relatives in Florida, we do a Florida show also. It's coming up, but give them Stephen's phone number if they're in the Florida area as well. Stephen, I can't wait for our next show. You're a superstar, bud.
Thank you very much. We appreciate the opportunity. It means a lot to us.
We'll see you again soon.
Yes, we will. Take care. Bye-bye.
Thanks, Stephen. That's Stephen Fromm. Folks, I'm telling you, I had a bad Medicare agent my first year. Second year, I found someone who was excellent. This was before I met Stephen. This is going to do it for us today. We'll be back again with you next week with more Ask the Experts.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.